and welcome to another tutorial video on how to use the ICRS patient registry. Today we're going to show you how to add some information about your patient's condition before their procedure. So we've already shown you how to search for a patient and how to add a patient. So the first thing that I'm going to do is to find the patient that I want to add the information about. So we previously made a patient called testing in one of our other videos. And what we'll see here is some red conditions and some blue conditions. So under the blue conditions, you can see the patient's history. So they've put in some information about themselves and they've also put in their height and weight. They have also filled in the outcome scores for the baseline. So we've got the EQ5D and the COOS, and you can see the scores for the patient here very easily. You'll also see that there are some future tasks for the patient, which says that in 6 months' time, they'll be asked to do these questionnaires again. Now, for you as the clinician or a delegate, you have to complete these red conditions. So the first one that we're going to show you today is the clinician's clinical assessment, which is the same as the pre-procedure assessment. So you can either go in through this way, or you can click here on the red. So what you want to put in here is the day that you saw your patient in the clinic. So let's pretend that we saw them a month ago, roughly. And you can add in some information here about how long the patient had symptoms and whether they've got problems with the opposite knee or other joints. Now, what you'll see is that there are some questions that have red outlines and some that don't. And what this means is that the ones with red outlines are mandatory, whereas the other ones are voluntary and optional. And in the right-hand corner here, you'll see there are 3 validation errors. What this means is that there are 3 questions that you have not yet answered. So for this questionnaire, there are only 3 questions that you have to answer for each of the patients. So it's very quick to fill in if you don't have a lot of time. If you do have the time, you can add in some more information about the patient. However, otherwise, all you need to do is to fill in these mandatory questions. Now you'll see when you click certain treatments, you can add more than one. And for this, I'm just going to say they've had none. And you can also do the same thing for surgery. And they'll ask you if they've suffered a cartilage injury, did they suffer an associated injury at the same time? And you might not know at this stage. And then you'll be asked if their leg alignment is normal, excess valgus, or excess varus. And then there are some more optional questions that you can answer if you have the time. But if you don't have the time, then that's okay. You can also go back to complete those optional questions at a later date. So say that you've come back at a later date and you just want to add a bit more information, you can go back into the form this way and add some more answers to the registry. Then you save, and what you'll see then is that you only have 1 remaining questionnaire to complete. So that is the end of this tutorial. If you want to learn how to input the procedure or treatment that you're doing with that patient, then please watch our other tutorial videos. Thank you very much.